Good evening and a very warm welcome to all of you in this live interactive session on fibromyalgia with you. Many patients across the globe, they have been requesting us to discuss certain points about fibromyalgia. Your question, Pravesh ji, Lovely ji, Smarth ji, they're all very important for us, and I'll be coming back to your questions once I have completed my topic on fibromyalgia. Fibromyalgia, as the name suggests, it is a disease where myalgia, the pain, is the most important symptom over here in fibromyalgia. And when we talk about fibromyalgia is a medical disorder which is characterized by chronic, widespread musculoskeletal pain accompanied by fatigue, sleep, and many other symptoms associated with it. Fibromyalgia amplifies painful sensations by affecting the central nervous system. So क्या हो जाता है fibromyalgia में? What exactly happens in a fibromyalgia patient? Generally, whenever a patient is experiencing pain, the pain occurs due to some specific reason. For example, if we are hurt, we'll feel pain. If a person is having arthritis, he will have pain. But a patient of fibromyalgia will have pain without any specific reasons. All of a sudden, what happens in a patient of fibromyalgia, that the central nervous system, the receptors for the pain, those receptors become oversensitive. There are multiple reasons, there are multiple theories that have been laid down that why it happens. But then the common thing in fibromyalgia is on various sides of the body, the person can experience pain, and generally the patient will experience a generalized pain. The patient will also feel lethargic. He won't have the activity level. He will also have stiffness. Many of fibromyalgia patients will also suffer from episodes of depression. So when we come to the causes of fibromyalgia, now there can be number of causes which can cause fibromyalgia. Genes can be one of them. Generally, fibromyalgia runs in families. Then it can be post-traumatic stress disorder. After a trauma, the stress disorder can lead to fibromyalgia. Generally, it affects more in females. The age generally is 20 to 50 years. So, fibromyalgia can cause problems in both the sexes, male and female, but in females, fibromyalgia is more common. Now, coming to the before prognosis, will be coming to the symptoms of fibromyalgia. That what exactly are the symptoms? There will be widespread pain and fatigue in muscles, jaw, lower limbs, and other parts. The joints will be stiff. The muscles will be stiff in the morning. There will be irregular sleep pattern. The sleeping won't be good one. And there will be difficulty with memory and concentration. It is also known as fibro fog. So they are some of the symptoms which we discussed about fibromyalgia. Now, once we further advance, I won't be going to the further symptoms, the generalized and the regional symptoms, because that will take a lot of time, and generally any patient who is suffering from fibromyalgia knows about most of these. And now coming to the prognosis of fibromyalgia. When we talk about prognosis, it means that what is the future of a patient of fibromyalgia. Although mortality is not there, the patient fibromyalgia generally does not pose a life risk, but then due to the pain, there is a lot of agony, and the risk of various metabolic syndromes creeps in. Chronic fatigue syndrome is one of those syndromes which is very common in patients who are suffering from fibromyalgia. And when we talk about the fibromyalgia, in allopathy there are various medications that have been guided for a patient who is having fibromyalgia. So now when we talk about the allopathic medications for fibromyalgia, the allopathic medical system, it generally revolves around the concept that two neurotransmitters, serotonin and norepinephrine, these two hormones, neurotransmitters rather, I won't say them hormones, I am correcting myself, these two neurotransmitters are the ones which are responsible for inhibiting the pain sensation in our body. When we hurt, the pain receptors, they carry the signals, and through a series of you can say transmitting modes, the pain finally reaches our brain, and then the pain is inhibited by serotonin and norepinephrine. Unluckily, the levels of both serotonin and norepinephrine are lesser in patients who are suffering with fibromyalgia. Another thing which has been noted in a patient suffering from fibromyalgia is that the cortisol levels, they increase. Cortisol generally is a hormone for fighting with the stress, and cortisol generally is a hormone which is an emergency hormone that is excreted out in the body. Adrenal glands are the ones which are associated with it. In a patient suffering from fibromyalgia, there are abnormally higher levels of this cortisol. It means that the inhibition which has to be sent from that hormone is also lost in a patient suffering from fibromyalgia. So, a fibromyalgia patient, when the patient goes to allopathic doctors for treatment, there are certain groups of medications which are given to them. The common ones being pregabalin, which is one of the medications that is given to the patient. And another medication, I'll just be showing you the medication, some of them. This one. Again, this is the second medication which is given to patients who are suffering from fibromyalgia in allopathy, and when we are talking about this medication, it inhibits the reuptake of serotonin and norepinephrine so that it increases their levels in the body. Then duloxetine is another medication which is given, which again increases the level of serotonin in the blood, as it is a SSRI. So these are some of the technical things which are involved in patients who are suffering from fibromyalgia. Now, what exactly in Ayurveda? The allopathic medications, if they are taken for fibromyalgia, yes, they can have a role towards decreasing the pain, towards decreasing the agony. But if we talk about getting rid of fibromyalgia, unluckily in allopathy, that is not possible. So in Ayurveda, is Ayurveda having a good chance and good prognosis and good promise of recovery in fibromyalgia? Yes. When we talk about fibromyalgia syndrome, which is again a syndrome which involves a fibromyalgia in its expansive phase, involving various muscles, various organs, and it is considered as Masgat Vayu. Ayurveda believes that when the Masvahe, Astiva and Majjavahe Srotas, they are vitiated, they are occluded, and and the Vayu, it is vitiated, and the Vayu, it gets connected, accumulated due to that, it is when the fibromyalgia starts. And the Vayu which we are talking about over here is Vyana Vayu. We talk about Vyan Vayu over here. When we talk about Vyan Vayu Dushti, the Vyan Vayu is the Vayu which is Sarvang, the full body Sancharit Vayu. And when there is Sroto Dushti of Masvahe Srotas, Astiva Srotas and Majjavahe Srotas, and Vayu also vitiates, it causes fibromyalgia. Now, with Ayurveda, we work on two levels in patients suffering from fibromyalgia. The first one is that we immediately do Srota reduction. There are medications which are known as Srotoshodhak medications, medications which are micro-channel purifying herbs. So those micro-channel purifying herbs are the first ones which are used in patients who are suffering from fibromyalgia with the help of Ayurveda. And then once they are done, there are certain herbs which are really very helpful in patients who are suffering from fibromyalgia. I'll be coming to the herbs one by one. The first herb is Shallaki, which is also known as Boswellia serrata. It reduces the inflammation, but although in fibromyalgia there is not that much of inflammation, still in cases of fibromyalgia, Shallaki has really been found very effective in giving patient relief in pain. Gingiber officinalis, which is also known as ginger, which is one of the most common kitchen herb which is used in our cooking, is again a very good herb in patients suffering from fibromyalgia. Talking about the next herb which is good in fibromyalgia patient, the next herb after these two herbs is arund, which is also known as Ricinus communis. Arund again is a very good herb. There is a combination of arund known as arund pak, which gives very good recovery in patients suffering from fibromyalgia. Rasna, that is Plusia lanceolata, is the next herb which really is very effective in patients suffering from fibromyalgia. Coming to certain combinations, it's not just the herbs which are very good. When we see that the pain and the agony of the patient is too much, then apart from the herbs, what is required in patients are certain combinations. And over here, the most important thing, the most important combination is Remocare. Remocare, we use a combination of many of these herbs with certain Srotoshodhak minerals, which really gives a marked improvement right from the very first month in patients who are suffering from fibromyalgia. And along with this Remocare capsule which I just showed you, the second medication which is a combination is Vedananashini. Now Vedananashini is a specific medication which contains Shodhit Vish as far as Ayurveda is concerned, and is one of the only painkillers which are available in Ayurveda, a painkiller without any side effect. And since it works on the levels of neurotransmitters, that is why, especially in patients who are suffering from fibromyalgia and are suffering with pain, this Vedananashini is one of the drug of choice. There are certain other Shodhan procedures which I am mentioning over here, like Patra, where a poultice of specified decoctions and herbs is made and is in a precise manner, it is circulated on the affected parts. Then Abhyangam is there, Swedanam is there with specified medicated oils, specified decoctions, and last but not the least, Nasya Kriya. So there are lot many procedures which we utilize in the patients who are suffering from fibromyalgia. So what I would like to add over here is, if you are suffering from fibromyalgia, it is not a disease from which you cannot come out. If you go for the Ayurvedic treatment, not only is the treatment harmless, but at the same time, in disease like fibromyalgia, you can expect a recovery starting in the signs of management of the disease starting right from the very first week of treatment itself. So, for any patient suffering from fibromyalgia, don't lose hope. Ayurveda can do a lot for you.